Hi, I'm Dr. Ron Miller of Pursuit Physiotherapy, and today we're going to go over 4 reasons why you may be still having hip pain after a total hip replacement. More specifically, we're going to go over 4 causes of that front hip pain. Okay, we've seen multiple cases where a patient gets a total hip replacement, and 3 to 6 months after the hip replacement, they're getting this anterior front hip pinching pain. And it's, sometimes it's extremely sharp, or sometimes it's dull, but they can't do things like go upstairs and get out of cars and stuff like that. So let's go over 4 possibilities of what could happen. Obviously, the first, let's call a spade a spade. There could be a prosthesis problem. Okay, and normally your physician is going to catch this on a follow-up visit. They're going to take an image and make sure that the hardware is proper. But there are some times where the hardware or the prosthesis is not binding down with the cement, or there could be an infection inside there and stuff like that. So that's the first one that has to be ruled out. Normally your physician is going to catch that on a follow-up visit. But what are some other causes? Another thing that we see, number 2, would be a leg length discrepancy. Okay. Sometimes the leg is shorter or longer. That could be causing this to be happening with standing or walking. Sometimes you're getting this front pinch pain, or sometimes with getting out of a car or getting up from sitting, or even in sitting, you're feeling this pinching pain. But a leg length discrepancy, meaning one leg is longer or shorter than the other after surgery, is another possibility. 3 is going to be a hip flexor problem, and this is sometimes correlated with a lack of hip extension also. It actually could be a lack of hip extension if you have an anterior approach. If you have a posterior approach, it could be the lack of full hip flexion that could be causing this hip impingement. But normally what we see in the clinic is the hip flexor is hypertonic or in spasm or in pain. And I just asked one of my friends who's a surgeon about this, and he actually sees scar tissue binding down on the iliopsoas or the hip flexor muscle. Then he actually does surgery and cleans it out, and they respond to this too. So the third option is going to be more of a lack of hip extension, or that hip flexor is the root cause of the problem, causing that hip impingement in the front of the hip. And the last thing is, it could be just kind of biomechanics. I hate using the term of an anterior pelvic tilt and stuff like that, but you have to look at this, is that you had an arthritic hip for years, and your body adapted and compensated for years to adapt to this arthritic hip. Now the hip is fixed, but what happened to the back? What happened to the pelvis and the SI joint? What happened to the knee and ankle over those years of time that these joints adapted to that painful, bad hip? Now the hip is fixed. It's titanium. A lot of times these low back, pelvic, knee, and SI joint changes are still remaining that could be underlying risk factors of why you're still having, or why this pain came, like a hip impingement. A lot of times maybe you have a anterior pelvic tilt, or there's a shift, or there's an upslip or downslip, getting into more advanced things with the SI joint. But a lot of times is, it's not as simple as just you take the car into the shop, you take out the tires, you put in new tires, and then you just go. Your body does adapt over years of having that bad hip. And some of these adaptations or compensations may be still there. That's why your hip pain started after getting a total hip replacement. So I hope this video helps. So there's 4 reasons why you may be having that front hip pain after a total hip replacement. If you have any questions or concerns for us, you can give us a call at 407-494-8835, or visit the website at pursuittherapy.com and let us know if we can help out at all. And thanks for listening. Bye.